Welcome to Lesson 3.5, Fall Prevention. Falls are a major safety concern for older adults and individuals with mobility limitations. As a care partner, you may spend more time in the client's home than many other members of the care team. This means you are in an important position to notice changes in mobility, identify environmental hazards, and help clients move safely. Fall prevention begins with awareness. A fall does not have to result in a visible injury to have a significant impact on a client. After falling, some clients become afraid to walk or participate in normal activities. That fear can lead to decreased activity, weakness, and greater dependence. Other falls may cause fractures, head injuries, hospitalization, or significant changes in the client's care needs. Our goal is to identify risks before a fall occurs whenever possible. Many factors can increase a person's risk of falling. A history of previous falls is especially important to know. Weakness, poor balance, vision changes, dizziness, cognitive impairment, and certain medications may also contribute to risk. Environmental hazards can make these risks even greater. Care partners should know the client's identified fall risks and follow the care plan. Knowing what is normal for the client helps you recognize when something has changed. If a client normally walks steadily with a walker but suddenly begins leaning, stumbling, or requiring significantly more assistance, that change matters. Do not simply assume the client is having a bad day. Maintain safety, document your observations, and report significant changes according to agency procedures. Many falls can be related to hazards in the environment. Take a moment to look around the client's surroundings. Is there a cord across the walkway? Did water spill on the bathroom floor? Has something been left beside the bed where the client normally walks? Identifying simple hazards before the client encounters them can help prevent a fall. Walking paths should remain as clear as reasonably possible. Items that may seem harmless to you can become significant hazards for someone with poor balance, reduced vision, or limited mobility. Pay particular attention to frequently traveled routes, including the path between the bedroom and bathroom. Follow agency procedures regarding environmental safety concerns. Flooring deserves special attention. Loose rugs can move beneath a client's feet or become caught under a walker. Wet surfaces can become extremely slippery. Changes in floor level can also be difficult for clients with vision or balance problems to recognize. Address hazards that fall within your assigned responsibilities and report other concerns. Poor lighting can make it difficult to see obstacles, changes in flooring, or furniture. Make sure commonly used areas have appropriate lighting. Nighttime deserves special attention because clients may wake up confused, sleepy, or urgently needing the bathroom. Use approved lighting arrangements according to the client's care plan and household preferences. Footwear can affect a client's balance and stability. Loose slippers, poorly fitting shoes, or slippery socks may increase fall risk. Follow the care plan and encourage safe footwear when the client is walking or transferring. Remember that clients retain their rights and choices, so concerns should be addressed respectfully rather than through confrontation. A walker or cane cannot help a client if it is across the room when they decide to stand. Keep required assistive devices accessible according to the client's care plan. Check for obvious problems such as loose parts or damaged equipment. Never independently substitute one mobility device for another. If equipment appears unsafe, report the concern. Some clients may try to move through their home by holding onto furniture. This is sometimes called furniture walking. Furniture may move, tip, or fail to provide appropriate support. Encourage the use of the client's prescribed assistive device according to their care plan. If you notice a new pattern of furniture walking, report the change. Many falls occur during transfers. The principles from Lesson 3.2 apply here. Prepare the environment before moving the client. Make sure equipment is positioned correctly. Lock wheelchair brakes when appropriate. Communicate with the client and never rush the transfer. If the client's ability has changed, stop and reassess the situation. Some people become dizzy when changing positions. particularly when moving from sitting or lying down to standing. After helping a client stand, allow them a moment to stabilize. Observe their balance. Ask how they feel. If the client appears dizzy or unstable, do not simply begin walking. Help them return to a safe position when possible and follow agency procedures. Clients may need more time to safely complete activities. Do not rush someone because you are behind schedule. A client who feels pressured may stand before they are ready, walk too quickly, forget their assistive device, or attempt something unsafe. Plan enough time to provide care safely. Bathrooms are common areas of concern because they combine hard surfaces, moisture, transfers, and sometimes urgency. A client who urgently needs the bathroom may attempt to move faster than is safe. Keep bathroom pathways clear and floors dry when possible. Follow the care plan for toileting and bathing assistance. Nighttime falls can happen when a client wakes up disoriented or attempts to reach the bathroom without assistance. Make sure the client's environment is prepared according to their care plan. Required assistive devices should be accessible. Frequently used items should not require the client to climb, stretch excessively, or navigate unnecessary obstacles. Dementia can affect judgment, memory, orientation, and safety awareness. A client may forget that they require assistance. They may stand without their walker or attempt to go somewhere without telling the care partner. Never assume that because the client remembers their safety instructions sometimes, they will remember them every time. Follow the level of supervision identified in the care plan. Some medications can contribute to dizziness, drowsiness, or other effects that may increase fall risk. However, care partners should not diagnose medication side effects or independently change medication schedules. Your role is to observe. If the client develops new dizziness, unusual sleepiness, weakness, or balance problems, report the change according to agency procedures. When someone urgently needs the bathroom, they may attempt to stand or walk without waiting for help. Respond to toileting needs promptly whenever possible. If the client's care plan includes scheduled toileting or specific assistance, follow those instructions. Never intentionally delay necessary assistance because you are completing another non-urgent task. After a fall, some clients become afraid of falling again. That fear is real. Do not tease the client or tell them they are being ridiculous. Provide reassurance and follow the established care plan. Encourage safe participation without forcing the client into an activity they believe is unsafe. Report significant changes in mobility or willingness to participate. If a client begins falling, your instinct may be to grab them and try to hold their entire weight. That can seriously injure both you and the client. Do not twist your body or attempt to support more weight than you safely can. If you have been trained to guide a falling client safely toward a lower surface, use that training. Once the fall occurs, follow agency emergency and fall procedures. After a fall, do not automatically pull the client back onto their feet. They may have sustained an injury that is not immediately obvious. Remain with the client. Follow your emergency procedures and obtain appropriate assistance. Notify the supervisor according to agency requirements and complete all required documentation. Some falls require immediate emergency medical attention. Follow the agency's emergency procedures and your training. Signs such as loss of consciousness, significant bleeding, severe pain, difficulty breathing, or sudden neurological changes should never be ignored. When an emergency exists, activate the appropriate emergency response. A client who strikes their head during a fall requires particular attention. Do not assume the client is fine simply because there is no visible wound. Changes in consciousness, confusion, vomiting, unusual sleepiness, weakness, or other concerning symptoms require prompt action according to emergency and agency procedures. A near fall can provide an important warning before an actual fall occurs. If a client suddenly begins stumbling or their knees repeatedly buckle, that information may help the care team identify a change in condition or adjust the care plan. Do not wait until an injury occurs before reporting significant changes. Fall documentation should be objective and accurate. Describe what you actually observed. Do not guess why the client fell unless you directly observe the cause. Document where the event occurred, what the client was doing, what you observed afterward, what actions were taken, and who was notified. Never hide a fall because you are afraid of getting in trouble. This example documents a near fall appropriately. Notice that it explains what happened without making a diagnosis. It identifies the client's reported symptom, the action taken by the care partner, and who was notified. That information can help the care team determine whether additional follow-up is necessary. Fall prevention requires consistent attention. Never rush a client or ignore their prescribed mobility equipment. Never attempt a transfer that you cannot safely complete. Do not leave a client unattended when their care plan requires supervision. And never conceal a fall or significant near fall. Client safety must always come before embarrassment, convenience, or fear of discipline. The correct answer is C. The client has experienced a change from their normal condition and is showing signs that walking may not be safe. Help the client return to a safe position when you can do so safely. Stay with the client and follow agency reporting procedures. If the client's symptoms indicate an emergency, follow emergency procedures immediately. Remember the word fall. Find potential risks before they cause an accident. Assist according to the client's care plan. Leave pathways clear. And look for changes in strength, balance, mobility, cognition, or other abilities that could increase fall risk. Let's review. Clutter, loose rugs, wet floors, poor lighting, and other obstacles can contribute to falls. Clients should be allowed time to stabilize after standing. New dizziness or balance changes should be taken seriously and reported. A client who falls should not automatically be lifted before appropriate assessment and procedures are followed. And near falls should be reported because they may indicate an increased risk or a change in the client's condition. You have completed Lesson 3.5, Fall Prevention. Fall prevention begins before a client ever loses their balance. Pay attention to the environment. Know the client's normal abilities. Keep required equipment accessible. Follow the care plan and never rush transfers or mobility. If a fall occurs, stay with the client. Follow emergency procedures, notify the appropriate personnel, and document what happened accurately. Most importantly, remember that fall prevention is not about unnecessarily restricting the client. It is about helping the client remain as safe and independent as possible. Next, we will complete Section 3 with Lesson 3.6, Transportation Safety.